The word has come down from Washington to the states. Get your plans in place to begin mass vaccinations against coronavirus as early as November. News 8's Joe LaFurgey is asking local health officials if they're ready for the task ahead. Joe?
There are some 650,000 residents in Kent County alone, so even if only half take the shot, it'll be a major undertaking.
I'm not really all that surprised in all the communications that we've been having from the CDC and from hearing down from the state is that we could see vaccine in early winter. So when they said be ready by...
Carla Black is the county's public health program supervisor in charge of emergency preparedness for the county health department. It will be her job to make sure the vaccine is available to residents of Kent County who want it. It's a big challenge. Depending on how much vaccine is sent to Kent County, it will likely be distributed to healthcare workers, first responders, and those who have medical conditions that would make them more susceptible to COVID, followed by the general public. Now, for years, the county's had a plan for mass vaccinations in place, but this virus is different.
We're really going to have to figure out how to space people out a little bit more, and so look at maybe some of our different facilities and different options to get vaccine into people.
And that's where the county's testing efforts come into play. A number of sites, both public and private, have been set up around the county for mass testing.
We've been working with a number of our community partners, and they have graciously allowed for us to work with them to get tests done. And so in the same model, we can actually use these places potentially as mass vaccination sites.
Now, CDC Director Robert Redfield sent a letter to states last week letting them know permit applications will soon be on the way from the company in charge of distributing the eventual vaccines to allow them to set up distribution facilities. The CDC's letter is asking states to waive some requirements that may slow down the process. In the letter, Redfield says the waiver would not compromise the safety and effectiveness of the vaccines. And while some believe good old-fashioned American know-how helped speed the creation of the vaccine, others have their doubts, especially looking at the November 1st date, 2 days before the election. We reached out to state health officials to get their take. We haven't heard back.